Hello, this is Andre with Tongue Tales on Mondays. And today's tale is about the tongue of a 65 years old female with the chief complaint of insomnia. Now, she would go to bed at random times, sometimes 11 p.m., sometimes 12 a.m., and she would be able to fall asleep. However, she would wake up 30 minutes later and would not be able to fall asleep for hours. She also suffers from chronic negative thoughts, concerns, and at night she has palpitations. In addition, she also has chronic postnasal drip. However, her sinuses feel dry and clogged. Now, let's see what her tongue would tell us. Now, you can see that the coating of her tongue is peeled, and that's an indication of yin deficiency. The tongue also seems to be dry, and that means fluid exhaustion. So we definitely are dealing with deficiency of yin and fluid exhaustion. And the shape of the tongue is small. That also supports the evidence of yin deficiency. However, we can also observe teeth marks on the side of her tongue, you see? And the sides of the tongue are a little bit swollen. And so in addition to yin deficiency, she also has dampness and probably spleen qi deficiency, because swollen tongue with teeth marks is an indication of spleen qi deficiency. And so these two signs seem to go in conjunction, because very often a person with yin deficiency, they want to compensate for lack of yin, which is a cooling substance, by producing dampness to cool off, to control this deficiency heat. Now, the color of the tongue is pale pink, and especially it's pale on the sides. And in conjunction with the dry tongue, we tend to think of this as liver blood deficiency. And kidney yin and liver blood, they mutually support each other. So we have a mutual kidney yin and liver blood deficiency. Now, you can also observe a pretty prominent vertical crease that starts at the root of the tongue and extends all the way to the tip of the tongue. And this has to be differentiated. When we have a crease crack in the middle of the middle 1/3 of the tongue, this is the area of the stomach. We think of this as stomach yin deficiency. But when the crack extends all the way to the root and all the way to the tip of the tongue, and especially in presence of other yin deficiency signs, we think of it as mutual exhaustion of heart yin and kidney yin deficiency. And that would be the chief cause of her insomnia. You see, yin energy, body wants to generate it at night. And in cases when body cannot generate yin, the rebellious yang, excess yang, rises up and disturbs shen. And that causes insomnia and anxiety, and also palpitations, because this heat excites heart and causes palpitations. Another important feature of this tongue are 45 degrees cracks in the anterior 1/3 of the tongue. And this indicates constitutional weakness of the lungs. And this would explain why she has dry sinuses and nasal obstruction, because this is lung yin and qi deficiency. And there is also a little bit of swelling in the anterior 1/3 of the tongue. So this is phlegm dampness accumulation in the lungs. So we have dual pattern in the lungs, where we have lung yin and qi deficiency, and in conjunction with phlegm dampness accumulation. And so she has postnasal drip, dampness, and dry and clogged up nasal passages due to yin deficiency. And so we want to nourish kidney, heart, and lung yin. We want to support kidney yang, because anytime we nourish kidney yin, we also want to support yang, because kidneys have two aspects, yin and yang, and they have to mutually grow and propagate each other. And of course, we need to regulate fluids metabolism, get rid of dampness, and to transform phlegm to help her with the sinus congestions, the postnasal drip, and overall dampness accumulation. And the chief herb for this person would be Shu Di Huang Rhymania glutinosa preparatum. This is the main herb in Chinese materia medica to tonify kidney and liver yin and replenish essence. And in addition to that, it also nourishes blood. Next herb in the formula is Shan Yao Diascorea. It tonifies kidneys, spleen, and stomach. It also tonifies lung qi and lung yin. So it nourishes kidney yin and lung yin. And this is a very forgiving herb. It is used a lot in Chinese health cooking. You can make porridge with it. And so it's very, very gentle. Mai Men Dong is the third herb in this formula, Opiopagones. It clears deficiency heat in the heart and the lungs. So it has effect on the upper burner, and it rebuilds yin and blood for nighttime irritability, restlessness, anxiety, and it treats insomnia. So it would be the chief herb to address dry and clogged nasal passages. Notice we are not really targeting nasal passages directly, we rather work with the lung qi, because remember that lung opens into the nose. Next herb is Guiban. It's actually not an herb, but rather an animal substance. It's tortoise shell. It's a very powerful tonic to tonify kidney yin and fortify the bones. And so for people who suffer from osteoporosis, or they are in concern that they may have some sort of bone loss in the body, this herb or this substance is much better than just calcium supplement. In addition, this substance tonifies liver yin and anchors yang. Because remember that in deficiency of yin, yang rises, and it causes night sweats, insomnia, and anxiety. And this herb anchors yang, and so it treats night sweats, great for all sorts of menopausal or andropausal symptoms, and it builds up blood and benefits the heart, and so it's a very good herb for anxiety and insomnia. Next herb in this formula is Suan Zhao Zhen, jujube seed. It nourishes yin and liver blood, calms shen, treats irritability, insomnia, and anxiety. So we have quite a few herbs that treat the root and the branch of this problem, insomnia and yin deficiency. Now, we need to balance those cooling and moistening yin herbs with one yang herb. And the best choice for this case would be zhou gui, cinnamon bark. And this herb is very often added to tonic formulas to boost efficacy, because it generates qi and blood and enhances circulation and absorption of other herbs. Next, we need to deal with phlegm dampness. And the first herb in this formula, in this category, would be Fu Ling Poria. It drains dampness and stimulates urination. And it also strengthens the spleen and transforms phlegm, because when we have phlegm dampness that accumulates in the body over a long time, and we have yin deficiency fire, yin fire starts cooking stagnant fluids, the dampness, and they become thicker fluids, phlegm. And phlegm is a lot more serious condition, and we want to prevent this from happening. Additionally, this herb also restores shen. It does not calm shen, but it also helps person to feel a little bit more comfortable with themselves. Next herb, Ze Xie Alismatis. It is a very common herb to add to tonifying formulas to prevent cloying. Remember, Shu Di Huang, the preparatum of Rehmannia, is a sticky, difficult to digest herb, and so we combine Zexie with Shu Di Huang to prevent cloying. It also drains dampness and stimulates urination, helps to get rid of stagnant fluids, and clears kidney fire, the root cause of the problem. And the last herb in this formula is Qianpi, aged tangerine peel. And it is a very common remedy in Chinese medicine and also in Chinese cooking. It also added to help digest cloying herbs, and it also transforms phlegm in the stomach and the lungs. And so we expect this herb to help to deal with the post-nasal drip. So there you have it. This formula treats kidney and heart yin deficiency, insomnia, and at the same time it takes care of the phlegm dampness affecting the lungs. Now, if you suffer from insomnia and would like to know what your tongue tells on you, do not hesitate to send us your tongue image and we'll talk about it next. I'm Andre with Tongue Tales on Mondays, and I will see you next Monday.